Hello, my name is Dr. Kian Lee. I'm a pediatric consultant from Firmipa Hospital, and my special interest is asthma. Today, I'm going to be talking to you about MART, which stands for Maintenance and Reliever Therapy. For some of you who are in general practice, you will be quite familiar with MART as it has been used for quite some time in the management of adult patients. However, with the new nice guidance for asthma, MART is going to be more commonplace in managing children and young people with asthma. MART stands for Maintenance and Reliever Therapy, and unlike conventional asthma treatment, which uses a preventer in the form of an inhaled corticosteroid, as well as a reliever in the form of a beta agonist, MART combines both treatments into one singular package, which can then be used by the patient both on a daily basis and also when their asthma flares up. This is obviously in accordance with the recommendations by WHO in the GINA guidelines published in 2019, which recommends that patients with asthma should not be prescribed with only a beta agonist and should always have a device which contains a form of inhaled corticosteroid. As such, MART treatment contains a short-acting in the form of formoterol, as well as a inhaled corticosteroid. There are different medication preparations available for MART use, the most common of which is Symbicort, which is the combination of budesonide and formoterol. But there are also other forms such as Foster, which is commonly used in adults, but is not licensed in younger people, which is a combination of beclomethasone and formoterol, as well as Flutiform, which is a combination of fluticasone and formoterol. As mentioned previously, the idea is that someone who is on MART will use their maintenance dose, which is usually 1 to 2 inhalations of their device twice a day. But if their asthma is playing up and they're having symptoms, they can use additional inhalations of their device. Now, this is the part that causes a lot of confusion amongst clinical professionals. So I'm here to try and make it as easy for you to understand as possible. If their asthma is playing up, they can increase their MART treatment to a maximum of 8 inhalations a day. So for example, if the patient is on 2 inhalations twice a day of their Symbicort, they can increase this to 2 inhalations 4 times a day, giving them a total of 8. They can stay on this treatment of 8 a day for a period of 2 to 3 days. But if their symptoms are not getting better, their peak flows are not improving, or they're not able to reduce the amount of inhalations they are getting, then they should see their GP, as they will need an assessment as to whether they require oral steroids. If they are on 8 inhalations total a day and their asthma is playing up, for example, at night when they're struggling to breathe, they can have an extra 4 inhalations they can use as a rescue, which means they will be using up to 12 inhalations a day. They should not use more than 12 inhalations total in a 24-hour period without seeing a doctor, which means that if they were using those 12 inhalations total, they should be making an appointment to see the GP on the very next day, or in an emergency, they should be calling an ambulance and coming to hospital for an urgent assessment. For a patient who is in the bind and their asthma is playing up and they are requiring urgent treatment, they can use a total of 6 inhalations at any one point, but in doing so, they should be calling an ambulance immediately. I hope this helps clear up a bit of information about MART, as oftentimes this number of inhalations is oftentimes confused even by healthcare professionals. I think that's it, Katie.